Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension, why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
Good evening, ladies and gentlemen. I am Dr. Colonel Amar Kumar Das from Armed Forces Medical College, Pune. I am a war veteran of Kargil, and I am now a consultant diabetologist and a hypertensionologist practicing physician at Berhampur.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
The reason of this is there is no hypertension. And what is hypertension? If suppose your BP is more than 140 by 80, if it is in two consecutive days, if the BP is more than 140 by 80, one should think it is hypertension. So once you are having hypertension, one has to be treated.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
Hypertension is a silent killer. The reason is we don't know what is the cause of the killing. So there is no symptom. So once there is no symptom, it can kill. So hypertension is a cause of mortality of more than 11 million people worldwide according to 2023 guidelines.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
After the age of 30 years, it is because of the essential or common hypertension. So 95% of people who develop hypertension is because of the essential hypertension. Only 5% of people, they are because of the secondary causes. The secondary causes can be because of renal, can be because of endocrine. Renal, commonest cause of hypertension is renovascular hypertension or pheochromocytoma, or it can be associated with other glomerulonephritis or glomerular syndromes. Endocrinopathies, commonest cause is also should be ruled out.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
Your BP is 140 by 80. It is more than that. You should always suspect hypertension. Pre-hypertension, so many people suffer from pre-hypertension. Once we know what is pre-hypertension, we can prevent hypertension. It has been seen that only 10% of the people who had pre-hypertension, they measure their BP in India and they can prevent. So if you can prevent hypertension and by taking drugs and adequate lifestyle medication, that will be better.
Can we say that hypertension can be treated without medication?
Prevention is better than cure, we all know. How do you prevent? By taking decreased amount of salt. The normal requirement of salt, particularly in Indian families, is almost 10 to 50 grams. Very high. If you can take salt that is less than 2 to 5 grams, we can prevent. How do you prevent? By good exercise, by decreasing the salt intake, by taking less of sodium and more of potassium and magnesium. So we can prevent by doing lifestyle and decreasing the weight. So this is the lifestyle modification one some must do to prevent hypertension.
Okay, doctor, you just talked about medication right now. So I would like to know what are the most common side effects that people should look out for while taking medications for hypertension.
So what are the medications available till date with us? We have got diuretics, we have got beta blockers, we have got calcium channel blockers, we have got ACE inhibitors, we have got ARBs. So there are so many drugs which are available to us, but the commonest drugs what we use is diuretics followed by calcium channel blockers or ARB. So once we can prevent hypertension, we can prevent complication. Thank you.
Related to that only, let's assume that somebody's blood pressure is coming under control. Can they come off medication or is it a lifetime commitment?
Hypertension is a silent killer. We have to prevent. How do we prevent? We have to regularly check the blood pressure and we have to do lifestyle. Lifestyle means we have to have a healthy diet, particularly decrease of salt, increase of potassium, good vegetable food, avoiding the non-vegetarian high cholesterol food, particularly meat and etc.
Okay, when you say reassess regularly, how often people should check their blood pressure and what's the best way to do it right?
And taking medicines regularly. You have to take medicines regularly. Every day, early morning, if you can take medicines regularly, we can prevent hypertension. If you can prevent hypertension, we can prevent complication and we can prevent deaths, because of morbidity associated with hypertension is very high.
So, this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.